When you're trying to fall pregnant, there's probably a long list of questions you want answers to. First of all, when you're in your 30s and you might have been taking the pill for a long period of time, does that actually affect fertility?
That's a great question, Nikki, because a lot of people are really worried they've been on the pill for way too long, but in fact it makes no difference whatsoever to their fertility, whether they've been on any form of contraception.
Okay. Now, what about with IVF? How much does it actually cost? And if someone's looking at the IVF process, how many cycles for them to actually see a pregnancy?
There's a lot of things that can affect how much it's going to cost and a lot of dependent factors, and so it's very individualised. So there would be healthcare rebates and Medicare rebates. Most women probably need 2 to 3 IVF cycles realistically to achieve a pregnancy, but again that's really dependent on other factors and the reasons that they've needed some fertility treatment in the first place.
Okay. And if someone is trying to fall pregnant, is IVF the only option if they are struggling?
Oh, certainly not. There's lots of therapies that we do before we get to IVF, and IVF is sometimes the last therapy that we choose. But again, it's individualised to a couple's circumstances.
So if someone is going through the IVF process and they're still struggling to fall pregnant, what might be some of the reasons?
There's a lot of different reasons why an IVF cycle won't work for a woman, and they can be anything from her lining of her uterus to the quality of the embryo to other factors within her medical history that may be affecting it. So again, her treatment might be optimised to give her a better outcome.
Now, what about gender? Because we do hear people speaking about designer babies. Can you actually choose gender these days?
Well, in Australia, no, we can't. It's legally not allowed to choose gender for family balancing or sex selection. But if there was an underlying medical condition that it was unsafe for a baby to be born of a certain gender, then we would be able to sex select for that reason.
Now, a lot of people are very fearful of fertility treatments because of the drugs that they have to take. Are there any side effects to these drugs?
I think a lot of women think they're going to be crazy when they go on the fertility drugs, but in fact most women don't have very many side effects at all. Probably by the end of their cycle they're quite bloated, but otherwise most women tolerate the medicines really well.
Now, if people still have more questions, how do you think that they should facilitate these conversations with their doctor?
Yeah, I think it's really important to be open and ask any question of their fertility doctor, because we're really happy to answer all questions and we've heard them all before, so we're really happy to answer them and prefer you to ask us than try to search it out yourself.
On Google.
Correct.